So thank you so much for taking the time to be on the show.
My pleasure. It's been so long.
I know it has, and I have wanted to do this for a really long time. And I've been following your social media and thinking we have to talk about hormone replacement.
Oh,
So,
definitely.
yeah. So would you mind though talking a little bit about what brought you into this field? Why are you so passionate about this?
Yeah, well, I always joke that I got into hormones because of sex, which is true. So, like, as you know, I started my podcast 5 years ago to basically provide comprehensive adult sex ed, primarily geared towards females, because I really think that they get the brunt of the short stick in regards to orgasmic inequality and how their bodies actually work and the crappy sex they're having. Right.
Right.
So I'm like happily existing in that world. And people kept saying, but you know what happens with menopause, but you know what happens with menopause. And I was like, well, no, no, blah, blah, blah. And then finally I was like, what's everybody talking about? And so for people who don't know, the rumor is your sex life goes away with menopause.
Mm-hmm.
And so I was like, all right, well, let's deep dive into that. Is that because it was the same thing with like female sex in the first place? It's like, well, there's data, just people don't know.
Right.
So I was like, okay, so with sex after menopause, there's data. What's it say? And people are having the best sex of their lives in their 70s, and other people's sex completely stops in menopause. And
Right.
started deep diving into how the pelvis changes, how hormones influence orgasm, arousal, elasticity of the vaginal canal, that
Right.
really tight spot at 6 o'clock in the vulva that is so painful for so many women when they lose their estrogen. And so kind of really got into the role of hormones in healthy pelvises. And then the WHI kept coming up, and this fear of hormones cause breast cancer. I can't take hormones because my sister has breast cancer. My mom, blah, blah, blah. Right? Like there's so much shrouded kind of mysticism, and
Mm-hmm.
nobody's sitting around being like, what's the actual truth?
Yeah.
Right? People are just like spouting their fears as if they're facts, and it's a bunch of bullshit, and nobody's getting help. And, they stopped having sex 8 years ago
Right.
because of untreated genital urinary syndrome menopause, which is like a $14 tube of vaginal estrogen solution. Right. And so really kind of got into like, oh my God, the fear of something your body naturally makes is harming you,
Yeah.
because we've decided we shouldn't replace hormones because that's not natural. Yet we've decided we want to live as long as possible, which is also not natural. Right. So it's like people are picking their natural. I always say we're shooting all over our women, that you have
Right.
to you
Right.
have to you have to do X, Y, and Z. And so that's a long answer to the question of like why I care so much about hormones is because there's so much bullshit,
Yeah.
misinformation, and subsequent harm and suffering because of lack of knowledge, which is the exact same thing that I did with female sex ed.
Right.
So it's like these massive topics just keep popping up.
Well, yeah, because they're there, right, and they're important. Could you speak just a little bit more to the idea that it's natural to replace our hormones? Because I have to admit, I was one of those people that thought, why are we fixing something that happens naturally in our body? It must be
Sure.
supposed to cease
Of
hormone
course,
production,
you're
right?
you're absolutely right. Take your glasses off.
Okay.
Why replace your eyesight?
Yeah. Okay. I love that metaphor.
Enough said, or should I keep
Yeah. No,
going?
I think that's perfect. Yeah. And your
Yeah,
idea
but
too that we're living so much longer than we
yeah,
used to.
don't replace your hip. Don't replace your teeth. Don't take something when you're constipated. Like the myth of natural for ovarian function is very weird. Don't ever get hearing aids,
Yeah.
right? And so it's like once you point that out to people, are you
Yeah.
wearing socks? Socks aren't natural,
Right.
right? Like where do you stop? Do you floss? Do
Right.
you
Where do you
brush
put where
teeth?
do you put the line? Yeah.
Where do
Yeah.
you
Yeah.
put the line? And if you're putting the line on controlling another woman's body, that's bullshit.
Right.
Yeah.
Right.
So I like
Okay.
to I like to point that out to people.
Okay.
And the other thing is if you look at longevity data, we're living now. We don't remember what living 300 years ago was.
Right.
But if you look at the records of the most privileged people, that would be male aristocrats, right? How long did the male aristocrats live in what was now England and Britain? 47.
Wow. Okay.
Yeah. So us thinking that 84 as a lifespan, as a population, is natural. No. And everybody will be like, my great grandpa, like everybody's got one outlier. And
Right. Right.
I'm not here to say humans never lived long, but as a population,
Mm-hmm.
We've never lived this long.
Yeah.
And now we're looking at our grandparents, at our parents, and we're like, I don't want to go down like that. I don't want to go down demented with a hip fracture, wet in my pants with urinary tract infections.
Yeah, don't
And
sign me up for that. Yeah.
right, don't sign me up for that. And you can't right that ship when you're 76.
Yeah.
You have to prevent that ship when you're 48, when you're 52. Hormones prevent disease. They don't treat disease very well.
Okay.
And so, like, that's the whole platform is like, once you give that, now that you have that information, aren't you more open to being like, hell, you're telling
Yeah.
me you can decrease my risk of all fracture by 50% if I take hormones? Yes, that's what I'm telling you.
All right. So here's a question. I'm 61.
Mhm.
So I'll share this. I just started hormone replacement like 3 months ago. So is it ever too late? Is it still worth it for people that are beyond 48? Is
Yeah,
there still benefit to do that?
that's a great question. So it's a long story, very short, is many people say you can't start after 10 years postmenopause. That's not true at all.
Hmm.
What they did was they took the current guidelines. Current guidelines say best benefit to risk ratio is the younger the better. That does not mean you can't start them 10 years after, right?
Right.
But people kind of drew a line in the sand. And the boomers are pissed anyways because the WHI, so boomers were 51 when the WHI got published, right?
Okay.
They were flat on starting menopause,
Right.
right? They didn't get, they got, if they were on hormones, they got them taken away. 80% of people got their hormones taken away. And so they're pissed. And now they're told they can't start. Because now we're saying, guess what? You can decrease your risk of dementia. You can decrease your risk of heart disease. You can decrease your risk of fracture. It doesn't mean it's going to, you're still going to age. That's the
Yeah.
big myth. Like
Yeah.
you're telling me, no, you're still going to age.
Yeah.
But you're just decreasing the risk. Your body uses hormones to function properly.
Right.
Right. So just giving yourself a little bit, and it's a little bit of hormones that goes a heck of a long way. So long story short is if you have an absolute contraindications, which are actually pretty darn rare, but for the average person who's 61, who's very healthy, who starts hormones, she's still going to get the fracture risk. She'll decrease. She'll probably still get the metabolic benefits of it, right? There's still lots of good sleep, mood. She's going to benefit from all of that. She's probably not going to get the dementia prevention risk. She might not get the cardiovascular protection because she spent 10 years without hormones.
Right. Right.
And the data really does suggest for those things, the younger, the better. Really, the thought leaders are pushing the envelope and because they're like, why aren't we starting in perimenopause?
Yeah.
Right? Like, why are we waiting for zero to then lift people back up? Why don't we support them? Because the biggest rate of bone loss in a woman's body is the 2 years before her period ends.
Uh-huh.
Now, how do you know when your period's going to end? You don't.
Right.
So it begs the question of like, why aren't we just starting in perimenopause to help support you? Because it's like, why have bone loss and then try to get it back? So hopefully that answered your question.
Yeah.
You're still
Yeah.
going to get some benefits. You're just not going to get the preventative benefits significance as if a woman started when she was 50.
Right. Right. And I will say there are sexual benefits that do.
There are
still
sexual
help,
benefits.
Right?
Absolutely.
Yeah.
Yeah.
So would you just speak to the WHI real quick? I mean, you're throwing it out there, but like, what was it, and what's so wrong with it?
Yeah. So the WHI was a randomized controlled trial, and that was government sponsored. NIH, it's like to the tune now of $1 billion because people are like, let's just do another one. And it's like, you don't understand how this works, right? This is like multi-site, multi-year. And what they did is, so we had data before the WHI that women who took estrogen had less heart attacks, had less heart disease, had less heart failure. And they said, but we don't have a randomized control trial looking at that. And so they said, okay, well, let's start one, but we can't start 50-year-olds on it because it takes them too long to have a heart attack. We need to start older people on it because they're closer to having the heart problems.
Okay.
That's our first problem. So this is a study looking at older women who already had risk factors. This does not apply to your average healthy 51-year-old.
Right.
So always in a study, doctors have to think, does this actually apply to me? Right. So that's the first flaw. The second flaw was that they didn't have many people who had hot flashes or night sweats or who were symptomatic. Again, two reasons. Number one, they were older.
Uh-huh.
So a lot of that does get better with time. But number two, they didn't want people to know if they were on the placebo or not. And hormones work so well at treating hot flashes and stuff. They're like, We need to pick people that don't have that so they don't know that they're on the placebo.
Mm.
Because then it's not a randomized blinded placebo controlled trial if you know you're taking the sugar pill, right?
Right.
So a couple of, some people had hot flashes, but most people didn't. And then the conclusion of the study was this doesn't improve quality of life. And it's like, well, yeah, if you didn't have a, bad quality of life anyways, because they cherry picked, right? So it's just, you got to pick apart the study. But here's the tragedy. So they went to the press, not all of the physicians. Some physicians went to the press before it was published, which is a big research no-no because
Right.
nobody could actually see what the data said. And they said, we're stopping this prematurely because taking hormones causes breast cancer. And people flushed their hormones down the toilet and doctors stopped prescribing
Right.
and women's quality of life didn't get treated and all of the things. And then they published the data and the people who read it and understand it are like, this is not actually that bad at all.
Mm.
But the genie was out of the bottle and the genie's now been out. The genie's just starting to get back in the bottle 22 years later. The damage was done. And I think it's a control issue. Like the best way to make a woman afraid, make her afraid of her own body.
Right.
Perfect power.
Yeah.
Yeah. So that's the WHI in a, no, the WHI did tell us some good things.
Okay.
Estrogen alone, so you don't have a uterus, you don't need progesterone. Estrogen alone decreases your risk of breast cancer by 20%.
Hmm.
So here we are thinking estrogen increases breast cancer when the actual data said it decreases breast cancer.
Wow.
Nobody talks about it. Nobody talks about preventing breast cancer taking estrogen. The other thing we learned, decreased risk of fracture by 50%, even if you didn't have osteoporosis.
Yeah.
Pretty impressive. Decreased risk of colon cancer by 30%. It's if you're taking hormones. So let's talk about you. Breast cancer is common. It's common, and it's mostly curable at this point. Number one thing that women die from in America: heart disease.
Mm-hmm.
Number one thing women die from who've been treated for breast cancer: heart disease.
Yeah.
So very curable condition. Wouldn't wish it on anybody, but curable. So if you are on hormones and you get breast cancer, because it's gonna happen, because breast cancer is common.
Right.
Being on hormones before decreases your risk of dying from breast cancer by 40%.
Yeah, nobody's talking about this.
Nobody talks about this.
Yeah.
But it takes a while. This is why podcasts are so good, is because it takes a while to explain all of this. Right. And it takes a while to even get across of listen, I'm a pretty good student of all of this because this is what I do. You can't just have somebody be like, it decreases your, you need to get into it and believe them, because in our heads is 22 years of thinking that taking something that your body naturally makes is going to hurt you.
Right.
Which, when you sit back and think about it, it's kind of silly.
Yeah.
Like if you're a diabetic and you need insulin, if you have a thyroid issue and you take thyroid, right? It's we're just giving you back something your body made. And we don't tell the diabetics and the thyroid people that's not natural.
Right. Right. Well,
we have a big judgment against ovaries.
Speaking of what your body makes, can you define and maybe speak to the importance, if it is there, of bioidentical hormone replacement therapy? What does that term mean?
It's a marketing term.
Okay.
What's natural on a candy bar mean?
All right. So really it doesn't mean anything more than that?
Natural on a candy bar means nothing.
Right.
It's a marketing term, right? So bioidentical just means it's something your body makes. Estradiol is bioidentical. Testosterone is bioidentical. Progesterone is bioidentical.
Okay.
That's all it means.
Are there options that are not? That would be ill-advised?
Birth control pills.
Okay.
Birth control pills are not bioidentical, right? Because they work in a way to trick your body into thinking it's already pregnant, right? So it doesn't release eggs. So it's not most high blood pressure pills, statins. They're all synthetic medications, antidepressants, right? Those are all synthetic medications. But somehow we throw a fit over hormones. It's the average person takes other medications that aren't bioidentical, and we're not oh my God, you do not have a bioidentical high blood pressure pill. Who do you think you are? We all there's so much judgment and shoulding. And why did so in the UK they don't call it bioidentical, they call it body identical, which makes more sense. It's this is just what your body made.
Right.
But So after the WHI and people got so freaking freaked out about hormones, it was kind of a marketing term to make people feel more safe.
Okay, right. Because your body makes this. It's exactly what your body makes, right? Okay.
Yeah. And in the WHI, if there was a bad actor, if there was anything that slightly increases risk of breast cancer, it is the synthetic medroxyprogesterone acetate that they used, which most people aren't using in hormone replacement at this point. But some people still need to take that, right? Like synthetics exist for a reason. Some people still need to take that. They don't tolerate the bioidentical.
Okay.
So it's too, the thing they say about experts is like, it's not black and white, right? Like the experts know, like it's not black. These synthetics exist for a reason.
Right.
And some people need them. And so for people to come by and be like, the synthetics are all bad is like, that's not true.
Right.
But the stuff your body naturally makes is the absolute closest. So there's really a lot less risks with them than putting something in your body that it doesn't make.
Right. Right.
Yep.
All right. So let's talk about contraindications. Some of the myths. I mean, you're already talking a little bit about the breast cancer one, but what are some of the myths people have about, oh, I can't take it because, and what are actually the contraindications?
The biggest one I see is my sister has breast cancer, so I can't be on hormones.
Mm-hmm.
Now you can flip that and be like, your sister having breast cancer is actually like a good reason for you to consider hormones
Because it is preventative.
because it decreases risk,
Yeah.
right? So, but like if a woman comes in, and my women who see me in clinic now, they're highly educated because they know my podcast, right? So like it's such a great population to take care of because they like know all of this already and it's just fun. It's like, where do you want to start? What do you want to do? So that's the biggest one though. Is like my mom had breast cancer. Well, yeah, breast cancer is common.
Right.
That doesn't mean if estrogen, you got to love these thought exercises. If estrogen causes breast cancer, it doesn't, but we're going to go there for a hot
Right.
second to make people think. Why isn't there more breast cancer when you're pregnant, when your estrogen's like through the frickin' roof? Okay? If breast cancer is caused by estrogen, why is more breast cancer in postmenopausal women who don't have any hormones in their bodies?
Mm-hmm.
Right? Like the logic does not hold up.
Yeah. Yeah. Okay. And so the idea that I have breast cancer or I have had it is equally right, not a problem.
No, that's not true. So breast cancer, think of breast cancer like a monster, right? And hormones are food. So food doesn't cause monsters, but monsters eat food.
Right.
Right? So if you've had breast cancer, you're being treated for breast cancer, you got to get the food out of the pantry. Kill the monster. Now, if you're well treated and it depends upon the type of breast cancer, because remember, breast cancer is not breast cancer is not breast cancer.
Right,
We're
right,
calling
right.
it one thing because of the location,
Okay.
but there's actually multiple different disease states happening. So it depends upon your type, but more and more educated people are saying, listen, these are some breast cancer survivors, of which there's 4 to 5 million in America now. Number one killer of them, heart disease.
Right.
They're worried about their bones. Their sex life is gone. Their energy's completely in the basement. Does their quality of life not matter? So more and more people are saying, listen, your body, your choice. This is a woman's advocacy. The data we have doesn't suggest your risk of recurrence is much higher, if any higher, than you not taking hormones.
Wow.
And but if she comes in freaked out, that's not my job to, like, I can give her the data, but it's like, I'm not here to not freak you out and make you take something you don't want. Most of the women who are on hormones after breast cancer, they want to be. They're going in with eyes wide open. They're like, listen, this could come back at any time. But is my quality of life not worth something? And and here's your other thing. Alcohol causes breast cancer. Do we make all women stop all alcohol after breast cancer? No, we let them drink. I would advise they shouldn't drink because that's a cancer causing thing.
Right.
But they do drink.
Information. Yeah.
Right. So if women are allowed to drink after breast cancer, certainly they're allowed to take a hormone that does not show a significant increased risk of recurrence.
Yeah.
And to clarify, breast cancer survivors and current breast cancer treating can take vaginal estrogen because that's just skincare. That's not even food for monsters. That's just skincare.
Yeah.
And so many women are not treating their genital urinary syndrome of menopause because of this big myth about hormones and breast cancer. But there's
Right.
an American College of Obstetrics and Gynecology ACOG position statement on the internet. You can go Google it. ACOG position statement for vaginal estrogen after breast cancer treatment. You can print it out. You can bring it into your doctor. You deserve to have your symptoms treated.
Yeah. Any other myths or ideas that people have? Like, oh, I can't take it because.
Oh, it's more like individual health thing and
Yeah.
more new, like rare stuff.
Yeah.
But
Okay.
big reasons that you can't take it would be like unexplained vaginal bleeding. You know, that's simple. You just work that up, see what's going on with that. Um, Transdermal, so estrogen patches are very safe and they're allowed to be used in a good amount of people. And especially like here's the deal. Why don't you get to make a decision about what goes in your body?
Hmm.
Like informed consent, risk benefit. You know, I had a woman who come in and she had, for example, she had never been on hormones. She was an older boomer. She'd had like a heart attack, a stroke, a blood clot, like all this stuff. And she's like, I want hormones. And I'm like, why do you want hormones? And she's like, oh, I think it'll help my skin or something like that. It was something that like wasn't particularly life-saving. It wasn't even like because I have osteoporosis. But I was like, listen, you're not the greatest candidate for hormones at this point, you
Okay.
know. And so it's really like an individualized conversation of like, how's your health? What do you want this for? How much risk are you willing to take? But at the end of the day, like women should get a voice and a choice.
Hmm.
These things are not like, think of what we prescribe people all the time. Narcotic, you know that antidepressants have a bone fracture risk? There's also a boxed warning for suicide on there.
Yeah.
Like, let's not dismiss the point that 25% of women in America are on those drugs.
Right.
Like, we take drugs that are risky all the time.
Right.
And we're talking like estrogen's like a five-headed sea monster of like, it's one of the safest medications out there. The UK Biobank, which is this massive population health database they can pull from basically, published this study in 2024 looking at what medications make people die more and what medications make people die less. And the ones that make you die more is because you were so stinking sick in the first place. You're like on these medications, right? Like kidney disease stuff,
Right. Right.
severe heart failure stuff. But there's some medications that if people take them, they actually live longer than the people who aren't taking them. And estrogen was like three of those products, or like
Wow.
3 out of 12. And so, you know, I always like to throw it in the face of women. If like, listen, if men had a drug that if they took it between age 50 and 60, they lived 3 years more, do you think they'd be on it? And women are like, yes, they would all be on that drug. And
Right.
I'm like, very well. That's
Right.
called estradiol.
Yeah.
Like we have that data, Jessa.
Wow.
Why aren't women doing anything about it? It's because they don't know it,
Yeah.
right? But and they can't, even when they do know it, they can't get over the like zeitgeist ether of 22 years of being afraid of something. Like
Right.
they need to learn how to process and realize science can be wrong, right?
Well, it's not even just all of us women, right? It's the providers that we go see. Are they still
Yep.
operating on old data? Who's informed enough to give women the information they need to make this choice?
Yeah.
That's
So the
that's
best, I
not that
mean,
easy to find.
it is. I mean, so it's certainly better now than it has been. There's tons of
Right.
online clinics. Alloy's one of them. Midi's one of them. Evernow's one of them. Intralude's great for vaginal estrogen. So there's lots of online clinics that they're there to treat your menopause. They're
Hmm.
there. They exist for hormones.
Yeah.
So it's like go use one of them. And number two is you call your doctor and you say, "Is Doctor blah blah blah? Do they treat menopause women with hormones?" Ask the question before you show up. If they
Yeah.
don't go to that appointment for that problem.
Right.
Save them for your strep throat and your pink eye and your sprained ankle and like all the other really important things we need primary care doctors for.
Yeah.
But so many people are like, I went to my doctor and then they said no. I'm like, did you think about calling and asking first? Like,
Yeah. Right. If
save
they.
yourself a trip.
Yeah.
Find somebody else.
Yeah. All right. So you're talking about estradiol, and the fear of that and all this. What about testosterone for women and hormone replacement? What's the role, the
Well, the biggest
risk
thing is,
benefit?
yeah, the biggest thing is libido. So you gotta back up because if somebody
Okay.
just hears me saying give women testosterone, they're like, why does she want to turn into a man? Because they don't have the information yet.
Yeah. Okay.
right? They don't know that ovaries make testosterone. And they don't know that estrogen only happens in your body because it came from the testosterone that your ovary made.
Yeah.
And if you don't know that, and then somebody says, oh, testosterone's great for women, then they won't listen to the rest of what I say because they were never taught, and I wasn't taught this in med school either. Like we
Okay.
literally have gendered hormones. If you Google it, Google says it's a male hormone. And the people will even be like, women can benefit from male hormones. And I'm like, can we freaking stop calling them?
Well, and
And
don't women make like 5 times as much testosterone as estradiol? I mean,
yes,
yeah.
yes,
So
because you have to make testosterone and then some of it goes to estrogen.
right. Right.
Yeah. So like that's the first education. And then you can be like, okay, so now you know that your ovaries make testosterone and it's not a male hormone. We just gendered it. So they
Hmm.
discovered testosterone in like roosters, right? And they discovered estrogen in like cow and pig ovaries, right? And so it's like, well, they just stayed gendered
Yeah.
the whole time. But it's like men need estrogen. When you block a man's conversion of his testosterone to his estrogen, his sex drive goes down.
Mm.
That's a New England Journal published knowledge,
Wow.
right? And the other powerful thing is, when I'm talking to a menopausal woman about estrogen, is like if she's got a male partner there, I'll point to him and be like, his estrogen's higher than yours right now. And that kind of like opens them up to like how incredibly low their hormones are.
Yeah.
And like hormone replacement or hormone therapy, like we're not trying to get you to a 26-year-old's estrogen level. We're not trying to get you pregnant again, right? Like we're just trying to get you to like a male level of estrogen because
Yeah.
it's great for your heart and your bones and your brain and your blood vessels and your
Right.
clitoris and all this stuff. So that's that. So testosterone has been used in women since 1940s, 1950s. It's been used for like 80 years,
Mm.
but it's still stigma, it's still shamed, and America does not have an FDA approved dose. The reason is a testosterone patch for women, which was 300 micrograms a day patch, went up in front of the FDA shortly after the WHI. And that was a time when hormones killed everybody and we have to protect the women. And if this is for sex drive, what do we need a bunch of horny women walking around for, anyways? And we need a lot more safety data. So they're like, we need 5-year safety data on this. Not good enough that we've been giving it to women since the 40s,
Right.
but like the company with their specific product needed 5-year safety data. Well, a 5-year safety data study is about $1 billion.
Wow.
So let me tell you how expensive that testosterone product's going to be, right? It's
Right.
got to pay. It's
Right.
got to pay for itself. Meanwhile, when men got testosterone FDA approved, they had 6-month safety data.
Hmm.
So there's a huge gender bias in protecting women. And I would say in doing that, we cause more harm than good.
Yeah. Are there other benefits to testosterone replacement for women than just libido?
There's libido. Well, libido's a mood,
Right.
right? That's a brain. That's a brain thing.
Okay.
So testosterone helps a lot of women's brains. And the problem is, number one, nobody studies a generic medication. And number two, our measurements for like memory, mood, like the tests we make you take, aren't capturing women's lived experiences with what testosterone does. I think they're the wrong studies.
Mm.
The other thing is like testosterone can take a while. It can take like 4 to 6 months for like things to kick in, right? So all these studies that say like we didn't show it, it's like, well, if you checked it in 9 weeks with a 10-point questionnaire, you're not going to capture what it did. So
Right.
I argue that all the studies aren't, they're not the end all be all.
Yeah.
For a doctor who's giving women testosterone and the women start coming back and telling you their story about how their life is better, you don't need any more data than that. These
Right.
women are like, the German I learned as a kid is coming back. My world feels more technicolor. I'm asking more questions. I actually want to get stuff done. My living room is clean because I have energy to do it. Right? It's like, how do you study those things? And the very common, very famous, I feel more like myself.
Yeah. Yeah.
Very, very hard to study.
Right.
You're never going to get an FDA approved product for this makes you feel more like yourself.
Yeah.
Right. And so you really, it's hard because as a physician, testosterone for women is not FDA approved for anything.
Right.
That said, it's made in your ovaries, it decreases slowly with age, and giving it back to people seems to improve their bones, their mood, their energy, they're feeling like themselves. I mean, all of those things, as you know, except for maybe the bones, you need that to have good sex in the first place.
Right.
Right?
Right.
It's like libido doesn't, you know this, libido
Yeah.
doesn't happen in isolation.
Right.
And so people are like, well, it only helps libido. And I'm like, that means it helps a hell of a lot
Right. Right.
because it helps all of this stuff and allows the libido to come up. It's like if you still feel like shit, you're still not gonna have a desire to have sex.
Right.
So it's tricky because the purists will say we don't have depression data, we don't have great mood data, and I would say that's true.
Yeah.
We don't, and we've been using this for 80 years. There's hardly any researchers for it, and I just see suffering women all day long. Like, what are you gonna do?
Yeah. You
You
gonna
know,
help?
I want to help. I want to help them.
Right.
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 And so is it because then you ask the other question. Okay, well, if we don't have a lot of data, but it seems to help a lot of women, are we hurting them? Let's use that as a metric. Is
Right.
this
Right.
unsafe? Right? No. We're giving again, going back to the bioidentical. We're giving you something your body naturally made, just makes less of as you get older.
Yeah.
We weren't all supposed to live till 84, but we all want to live to 84, right? Like, what do you want to do to be in the best shape and mental health and energy as you age? It's not going to prevent aging.
Right.
It won't make you like shitty sex. Like it's not a miracle worker. It is so, a woman reached out, she's like, I've been on testosterone for a year and I still have low libido. It's like, yeah, libido is complicated,
Right. Right. Not as
right?
simple as
It's not as
medication.
simple as notching up your testosterone by 20 points or even 80 points or whatever. So I love the topic of testosterone. It's complicated because
Yeah.
of gender bias and the FDA and how you study things, and it's a generic med, so there's no money to be made. And, all of these things that I think also, if it's a quality of life medication, if it just really does make you feel like more like yourself, if it does just give you some more energy, number one, that's incredibly hard to measure.
Yeah.
And number two, you're never going to get an FDA approved product for those things.
Right.
And number three, why wouldn't you give it to women to try it if that's what it helps? But is insurance going to cover a product that's FDA approved for feeling more like yourself? No. But I would argue feeling more like yourself is the most valuable thing
Yeah.
that a doctor can help a person with.
Yeah. Although FDA approved it for men, they must get more measurable benefits or something more concrete than feeling more like yourself
Well,
from
they've got
testosterone.
50 times more studies,
Yeah. Yeah.
right? But even men, I mean, men always get a little upset when I talk about women and testosterone because they're like, we don't have great access to it either. And I'm like, yeah, I know it's not good for anybody, but yeah, they've got multiple products. But why isn't testosterone a screening lab for men when they turn 50? Here's your
Right.
colonoscopy. Here's your testosterone lab, because low testosterone in men is associated with depression, weak bones, right? Diabetes,
Mm.
sleep apnea, right? Like all of these problems. And in men, they have the same thing of like, but are you suffering enough?
Right.
And the symptoms of low testosterone are incredibly vague. So you're like, what's a symptom of low testosterone? It's like, it's the symptom of lots of things,
Right.
right? Like fatigue, low energy.
Yeah.
Like, is it depression or low T? Right. So it's not clear cut for men either. But yeah, I mean, a vial of testosterone for men is like $10 a week. It's
Yeah.
super cheap.
Right. Right. And you mentioned progesterone. If you
Mhm.
have a uterus, I just want to give you a chance to speak to that too, since
Yeah.
that's the
Well, it's
third of the
progesterone. Yeah.
trio.
I call progesterone like, it's like the stepsister that gets ignored.
Right.
Like estrogen's like this beautiful, womanly, like wonderful, gets all the attention, and then progesterone's like, I'm
I'm
actually
here
kind of
too.
I'm a kind of a big deal. You just don't ever talk about me. So progesterone is what your body naturally makes. Then there are synthetic progestins, one of them being medroxyprogesterone acetate, which was used in the WHI. So because a synthetic progestin was used, and if there was any baddie in the WHI, it was that one. So
Right.
then people really were like, well, if you don't have a uterus, you don't need it. You don't get it. Only take it if you have a uterus. And progesterone's like, I don't exist in your body just to protect your uterus, right? But so your uterus needs both estrogen and progesterone to be a healthy functioning organ. I get a little irritated when people are like, well, estrogen causes cancer of the uterus. It's like, well, yeah, if you don't have progesterone in there and it's like an unbalanced and otherwise it doesn't
Mm-hmm.
cause cancer of the uterus, right? So if you have a uterus, you have to take a progesterone to keep that organ happy. That organ needs both. Fair.
Right.
1/3 of women have hysterectomies.
Wow.
Progesterone helps. It works. Oral progesterone gets processed through the liver and makes metabolites that are like GABA in our brain. So anti-anxiety, soothing. It's wonderful for sleep. I take my progesterone before bed. Most people take their progesterone before bed because just like he keeps you sleeping.
Mm-hmm.
It's generic. It's cheap. It's safe.
Yeah.
It's just forgotten.
Right.
But
Right.
I think now, like in 2025, more people are like, because it was like, don't take it if you don't have a uterus, you don't need it. And now people are like, can I try it? I don't have a uterus, but can I try it? I'd like to sleep. And they're like, oh yeah, I love my progesterone, right? So
Yeah.
it's getting freed from the shackles of like it was only for your uterus and all that. It's more like, oh no, this helps the brain too.
Yeah.
I mean,
Okay.
I don't think the other bad thing about estrogen, progesterone, and testosterone is they're called sex hormones.
Right.
And
As
the
if
word
that's
sex,
their only role. Yeah.
yeah, that's
Who's
their
gonna
only
value
role.
that?
Yeah.
Right.
So they're extra, right? And they're not necessary. And to me, if I got my way, I would like to rebrand them neurohormones
Mm.
because they absolutely, I think the brain actually makes them, right? We talk about the ovary and adrenals making them, but the brain also makes them too. Um, Low testosterone, increased risk of dementia in men.
Yeah.
Women, estrogens, neuroprotective. Women who take estrogen have decreased risk of Parkinson's, multiple sclerosis, all cause dementia. And again, you got to start it earlier. You can't let the damage be done and then take it. It doesn't
Right.
work as well for preventing it. So, yeah, these are neurohormones.
Yeah. I love that. Anything I forgot to ask you, or any point you want to make about this while we're on the topic that I didn't?
No, I mean, this is a great overview. To me, like, what I want women to know is like everything you've been told is not true.
Mm-hmm.
Question things. Fear is a great way to control you. It's amazing how many women like they're just fine being afraid. I'm like, do you want to maybe get some education and like learn some stuff and then maybe not be afraid?
Yeah.
Like, so it's an option,
Right. Right.
right? Seems hard for some people, but it's like it's really like the more you know and the more you're in control of what your choice is, like you're probably not on hormones because somebody told you to be on hormones. Like it's your choice.
Mm-hmm.
And if it's your choice, it's all the more powerful. Like own it. That's what you are taking care of your body. And it won't prevent aging. And some people still do get breast cancer, but that's the world.
Right.
And I think this infantilizing of women of like, well, we're just here to protect you. We don't want anything bad to happen to you.
Yeah. Save
Is
you
like,
from yourself.
yeah, it's like,
Yeah.
listen, bad shit happens.
Yeah.
Less bad shit happens when you take hormones when your ovaries are run out. And don't tell me it's natural because then you got to take off your socks and you got to take off your underwear and you got to take off your glasses and you got to take out your hearing aids. You got to take out all the teeth work, dental work that you've had done because none of that's natural either. So stop being so biased against the ovary.
Yeah. Love it.
And the other exciting thing about like looking to the future is like, my friends, you realize there will be a time when menopause is optional. We will have figured out longevity of the ovary.
Mm.
And then we'll be like, oh, wasn't it so cute that we actually had to take patches and pills to like replace that? Right? Like, we're in this like temporary phase where they're figuring out why menopause happens. It's probably the brain. There's probably some like signal. And we just got to figure that out. And then we'll be like, okay.
Huh. Well, I gotta say, I don't miss menstruation.
Right.
I don't think I want that back, but
Yeah.
yeah.
Yeah. But like, that's the thing is like, people are like, I don't have to take hormones. And it's like, yeah, but there's like amazing, like the wisdom that comes with age and like not having to have periods, not having the fear of pregnancy. Like we're so entitled to want things to be exactly our way. And it's like, that's not how the world works, you guys.
Right.
Like, sorry.
Right.
We're all unique and special, but like that's not the way the world works. Sometimes you have to replace what your ovaries stop making because average age of death for all of humans was like 51.
Yeah. All right. Where can people find you?
I'm
Social
in,
media, your
yeah,
podcast,
well,
and
my
then where you're
clinic is
practicing.
Yeah, I practice private practice, sex med and hormones in Bellingham. It's called the Casperson Clinic. It's opening this spring. There is a wait list. I encourage you to get on it.
Okay.
And but yeah, I basically I just want to know people. I'm gonna have very long appointments, and we're gonna drink coffee, and we're gonna go on walks, and I'm gonna listen to you
Mm,
because
mm,
that's what's currently broken in the healthcare system. Is
yeah.
that women aren't listened to, they're not believed, they're not seen. So that's what I'm creating. And that's called the Casperson Clinic. You can go to kellycaspersonmd.com. My book and my podcast are called You Are Not Broken. And I love hanging out on Instagram at Kelly
Yeah.
Casperson MD.
Wonderful. Well, thank you so much.
Thanks for having me.